Most people believe that early retirement means financial ruin from health insurance premiums, and that the only alternative is being trapped at their job until they turn 65. But I've helped numerous early retirees find a pathway that turns the ACA Marketplace from an expensive last resort to their secret weapon for healthcare savings. The early retirees who are figuring this out are saving substantial amounts on premium costs. They're discovering that they may be able to save $20,000 a year or more on insurance expenses, which has made the difference between them being able to retire early and them being stuck in their jobs and bound by golden handcuffs. So today, I'm going to share with you everything you need to know about the health insurance marketplace and reveal the exact income optimization strategies that you can use to unlock these subsidies. By the end of this video, you're going to understand exactly how the system works and how you can position yourself to leverage the marketplace and maximize your benefit. Let's dive in. First, I just want to talk about what the marketplace is, how it works, and how your health coverage actually gets priced. And then I'm going to take us shopping. We're going to go to the health insurance marketplace website, and we're going to look at real plans and the real costs associated with those plans. And then we're going to walk through 3 income optimization strategies that we can use to leverage the marketplace to your advantage. So what exactly is the health insurance marketplace? Well, the marketplace was created by the Affordable Care Act, and the idea of creating this marketplace was that everyone in the United States would have access to health insurance if they couldn't get it elsewhere. So if they were not eligible for Medicare, if they couldn't get on Medicaid, if they couldn't get private coverage, or if they couldn't get coverage through their employer, right, they would still have a place to go. Right? That is why the marketplace was created. Now, in the marketplace, there are 4 levels of coverage, right, 4 tiers. There's the bronze tier, silver tier, gold tier, and platinum tier. Now, also really important to understand is that coverage is not priced through individual underwriting, right? Because the idea is that this is essentially going to act as a group plan. So pricing is going to be based on age, location, tobacco usage, plan tier, family size, and income, with those last 2 being the most important, being the family size component and the income component. And we're going to talk about that in just a moment here. Now, the income amount is not just any regular income number. What's actually referring to is modified adjusted gross income, which is MAGI for short. Now, modified AGI is not a standalone number that's on the tax return. We actually have to run a calculation to back into what our modified AGI actually is. So we're going to start with line 11 on our tax return, which is our adjusted gross income. Then we have to add back a few things. So we have to add back any non-taxable Social Security benefit we may have, and we have to add back any non-taxable interest from municipal bonds, for example. And also, if it applies, we have to add back any untaxed foreign income. Once we've put those 3 numbers back into our adjusted gross income, right, we now have arrived at our modified adjusted gross income number. Another really important thing to understand with modified adjusted gross income is that sometimes the calculations are different for different parts of the tax code. For example, modified adjusted gross income in the calculation for the health insurance marketplace is a different modified adjusted gross calculation income than the modified adjusted gross income calculation for Medicare IRMA. So it's really important that we understand which calculation we're using to come up with this modified AGI number and what we want to accomplish. But this number is really important because this is going to be what's used to referenced when the government is figuring out what our expected premium contribution is going to be, which then is actually used in the premium tax credit calculation. Now, what the premium tax credit is this is the actual subsidy part of the ACA program. And the way this all works is that health insurance premiums are essentially lowered via an advanced tax credit. And so the way this all kind of happens logistically is that you're going to go enroll in the health insurance marketplace, and you're going to provide an estimate of what your income is going to be over the next year. Based on that income amount that you gave on the application, or the government will say, hey, do you qualify based on your income for this premium tax credit? And if yes, they're going to pay that tax credit upfront in advance directly to the insurance company in order to keep your monthly out-of-pocket low. And then it all gets reconciled on the tax return when you file your taxes for that year. And so this is going to be really important that we understand how we control our modified adjusted gross income and what this all looks like, and therefore what our expected premium contribution amount is, because this is going to then control how much of a premium tax credit we receive and what the cost of our premiums will be for that given year. Our expected premium contribution amount is going to be based on our income in relation to the federal poverty line. So the federal poverty line for a household of one is $15,000. For a household of two, it's about $20,000 a year. And this is modified adjusted gross income. And this is why I said that the household number and the modified adjusted gross income number are the two most important parts of the pricing calculation, because this is where we have the opportunity to actually dive into some planning. Now, the higher our income is, the higher our expected premium contribution is, up until we get to about 400% of the federal poverty line. And an important distinction is that for 2025, we're actually still grandfathered into that expected premium contribution calculation. However, 2026 rules would say that anyone over 400% of the federal poverty line will no longer receive a premium tax credit. And so this is what these percentages are going to look like. If our modified adjusted gross income is less than 150% of the federal poverty line for our household number, we have a 0% expected premium contribution, based on our income, and therefore it's a $0 expected contribution. Now, as our income increases, farther and farther above 150% of the federal poverty line, we have a higher expected premium contribution as a percentage of our income. Starts at 2%, then it goes to 4%, then 6%, and then 8.5%. Right now, again, for 2025, even if we have income, well over 400% of the federal poverty line, our expected premium contribution will just be 8.5% of our modified adjusted gross income. And if the second lowest cost silver plan, in the premium tax credit calculation is more expensive than our 8.5% expected premium contribution, we would still get a premium tax credit. That is only for 2025. 2026 and on, we would expect to get 0 premium tax credit, even if we could have qualified one based on these numbers here, because the tax rules are going to change. And so let's actually quantify this. So we're going to run through an income situation here, and then we're going to dive into the health insurance marketplace. So let's just say we're a household size of 2, and our modified adjusted gross income is $250,000 per year. That's going to mean that we are well over 1,200% of the federal poverty line, and our expected contribution is going to be 8.5% of that modified adjusted gross income number. So that's $21,000 a year, or $1,700 per month. So let's actually see what this would look like if we were to go and try to get onto some health insurance today. So here we are on the healthcare.gov website. I've gone ahead and already put in a lot of the initial inputs. So we're going to use my zip codes. I'm in Arizona. So we're going to look at some Arizona plans, and we're going to look at a married couple, both age 64, that are both going to need to enroll in the health insurance marketplace. Now, in terms of income, we're going to look at that $250,000 number. And this is, again, modified adjusted gross income. And what we'll see here is that at $250,000 of modified adjusted gross income, based on the Arizona plans available, we do not qualify for a premium tax credit. So let's take a look at what these full price plans might look like. Our bronze plans, so we're going to look at bronze, silver, and gold plans. Our bronze plans are going to start at $1,467 per month. Again, this is for a household of 2. And this is all sorted from lowest premiums to highest premiums, So then if we look towards the bottom here, if we just jump to the very end to say, hey, what's the most expensive policy we can get on at the marketplace in this situation? We are going to find that we're going to pay about $4,100 per month, for the most expensive plan. Now, I will say, just because the plan's the most expensive doesn't mean it's actually the best plan. So it's really important that you actually dive into the details of each plan, and fully understand what this looks like, so that you get the coverage, that's necessary for what you need personally. But what I want to draw your attention to here, and this is going to be really important, is what does the cost or what is the cost of our second lowest cost silver plan? Now, in this case, our second lowest cost silver plan, and this is going to be the number that's used in that premium tax credit calculation, is $1,743.72. And so if we just ran the quick math, right, $1,743 minus $1,770 would mean that we're going to get a negative number, therefore not going to get a premium tax credit at a $250,000 modified adjusted gross income number. And so from here, let's look at a different income situation. So let's look at our income. If we are a household of two, right, and we're going to have a $125,000 modified adjusted gross income amount, right, we're going to be at 612% of the federal poverty line. We're still at 8.5% contribution amount. That's looking like a monthly expected contribution number of $885. Again, really important here that we're understanding the modified adjusted gross income number. We could still have $250,000 of total spend, right? But if we manage the tax return and manage our tax situation so that only $125,000 of modified adjusted gross income shows, right, we're going to have a whole different set of premiums that we're looking at. So if we go back to the Health Insurance Marketplace website here, right, and we're going to now update and modify the income amount to be $125,000 of modified adjusted gross income. That's going to show we're going to get a premium tax credit of about $859 per month. So I'm going to jump right to the silver plan here, and then we'll talk about some of the other plans. If we go back to that second lowest cost silver plan, right, back to that premium tax credit calculation, you're going to see the plan was $1,743 at full price minus our expected premium contribution of about $885 gives us an $859 premium tax credit. And therefore, no matter what plan we pick, right, whether it's a less expensive plan or it's a more expensive plan, we're always going to have just that fixed $859 premium tax credit. And therefore, right, if we go back to and look at some of our bronze plans, right, we may find that we're down to only about $600 a month in premium expense here. Again, just by cutting down that income. Right now, in this case, we cut that income in half. But let's say we wanted to go even further. If someone said, you know what, I want to maximize my premium tax credit, what does that look like? In that case, we would actually need to be right at that 150% of the federal poverty line number for a household of two. And that is going to be about $30,000. So let's say we got really aggressive with our tax planning, and we're only going to show $30,000 of modified adjusted gross income on the tax return. We're going to get a $1,744 per month premium tax credit. Now, again, if you think about that second lowest cost silver plan, this is the exact amount of that second lowest cost silver plan. So we're looking at $1,744 minus an expected contribution amount of zero, right, is the equivalent to our premium tax credit. And so what you'll find is that all of our bronze plans here are going to be zero premium plans. And then if we jump to that silver plan, we want to look back towards our second lowest cost silver plan, right? It is now free. And then every plan above that, that's a little bit more expensive previously, right, now just has a smaller and smaller monthly amount. And so what's really important to understand here is that maybe we don't need a silver plan, right? In which case, if we're happy with a bronze plan, then we probably were too aggressive with the tax management here because we didn't need to actually get that low on the tax return in terms of modified adjusted gross income. On the flip side, if we did need more comprehensive coverage and that coverage would be more and more expensive, right? In that case, we would want to get as aggressive as we could so that we would bring down the cost of that comprehensive coverage as much as possible. But let's say, right, we want to now get on a silver plan and we want it to be pretty low cost, but we also want to then make the most of our lower tax brackets. So let's say we're going to change our income number to $60,000 of modified adjusted gross income. How does that impact our premium expenses? We're still going to get a $1,457 premium tax credit based on the plans available today here. And if we look at some of these bronze plans, right, we're looking at $10 a month, $20 a month, right, $50 a month. And so these become very, very, very affordable. And so it's really important, again, to understand is that it's not all or nothing when it comes to claiming this tax credit and managing these subsidies, right? We can find a place in the middle, right, where we're happy to pay a certain dollar amount for these health insurance premiums, but right, we want to be sure that, right, if we are able to manage some savings, we're definitely going to go ahead and get as much as we can so that we're not going to overpay for these policies. And so in that case, let's take a look at 3 income optimization strategies that we can now use to manage this modified adjusted gross income number and maximize our premium tax credit. So one of the things that we're going to want to think about doing is spending our Roth IRA money in these pre-Medicare years. Now, I know this might sound like a wild, crazy strategy because, all we've heard and thought about for the last several years is how much money can we get into these Roth accounts. But if there was a time to spend the money that's in the Roth IRA, now would be one of those times where it might make a lot of sense. And just to give you an apples-to-apples comparison here of if we're spending $10,000 per month for retirement lifestyle, what would it look like for our healthcare purposes or health insurance premium purposes if we were to spend it all from the traditional IRA versus if we were to split it and spend the majority from our Roth IRA and only a little bit from the traditional IRA. And so if we look on one hand here, right, traditional IRA withdrawals amounting to $120,000 a year means our modified adjusted gross income is $120K. That puts us at well over 500% of the federal poverty line for a household of 2. Our expected contribution is going to be $10,200 per year. Whereas conversely, we could still spend $10,000 per month, but if we spent only $30,000 from the traditional IRA and then about $90,000 from the Roth IRA, right, we are now at that 150% of the federal poverty line number, meaning our expected contribution amount is $0 and 0%, right? So we can save a lot of money in premiums if we just pick and choose, right, how we want to manage our withdrawal strategy with tax efficiency in mind. Now, you may be saying, well, all that sounds great, but I'm getting ready to retire here in the next 5 years, right, or the next 1 or 2 or 3 years, and I don't have $90,000 a year worth of Roth IRA dollars to bridge the gap between when I want to retire and get onto Medicare. What do we do then? What does that look like? In that case, we may actually want to implement Roth conversion ladders, right, in the years before we retire and then get onto the health insurance marketplace. Now, what's going to be really important about this Roth conversion ladder is that we're understanding the Roth IRA 5-year rules, which is why very often we would actually have to ladder these conversions. And so just to very quickly have a very brief overview of what those 5-year rules are before we take a look at what a Roth IRA conversion ladder might look like for you or for someone that wants to get onto insurance marketplace. The first rule is that all Roth IRA contributions can be withdrawn anytime, right, for any reason without any tax or penalty. Right? That's the contribution amount, and that can happen before 59 and a half. And then second rule is Roth conversion amounts can be withdrawn penalty-free anytime after age 59 and a half or, right, after a 5-year holding period. And the point of that is to not circumvent that early withdrawal limitation of 59 and a half. Then lastly, earnings on contributions or conversions can be withdrawn tax-free or penalty-free if the account has been open for at least 5 years and the owner is over age 59 and a half. And lastly, right, in order to follow these rules, all these withdrawals come out in a sequential order, which is contributions first, then conversions come out, and then earnings come out. And so again, this is just a pretty high-level overview of what those Roth IRA 5-year rules are, just so you have a little bit of knowledge of this going into this Roth conversion ladder conversation. And so in terms of what a Roth conversion ladder might look like, let's say we are 5 years out from retirement and we're going to have a 5-year period before we get onto Medicare. So let's say we're just going to retire at 60. We need to bridge the gap 5 years. What this could look like if we, again, just use the example we just looked at where we're going to want to spend $90,000 a year from our Roth IRA. Now, that may not make sense based on your tax and withdrawal needs, but we could always tweak these numbers to be appropriate for exactly your situation, right? But just using that example, what this would look like is 5 years before retirement, we're going to start converting $90,000 per year. So year 4, convert 90. Year 3, convert 90. Year 2, convert 90, right? All the way up until we retire. And once we retire, we're going to get onto health insurance marketplace coverage. And then we're going to start spending $90,000 a year from the Roth IRA. And that is going to allow us to take all those withdrawals tax and penalty free and keep our modified adjusted gross income low so that we qualify for the premium tax credit or maximize the amount of premium tax credit that we can qualify for. So an alternative to this, right, because we do want to value these Roth IRA dollars and keep as much money as we can in this account if we can, would be to actually spend our cash and non-qualified dollars first. And so what this might look like is this, again, we're going to use the same $10,000 per month spend, right? Get us $120,000 a year in retirement income. But if we spend, about $90,000 from our cash or from our cost basis and principal, right? And then we only realize about $30,000 of capital gain income, right? That means our modified adjusted gross income is only $30,000 a year, right? We're now at 150% of the federal poverty line. We would qualify for a $0 and 0% expected premium contribution amount, and therefore can maximize our premium tax credit. Now, we again may find somewhere that's more in the middle, where we don't need to be as aggressive as getting down to $30,000 a year in modified AGI. But again, just to share the illustration with you of this is how this would work if we wanted to actually maximize the premium tax credit and pay the least amount possible for the plans that are available to us. But lastly, this third strategy would actually be a blended approach, right? We may not have the right amount of dollars in these three types of accounts to actually bridge the whole way just using cash or just using Roth IRA money. And in which case, we may want to look at picking and choosing how much comes from each of these three types of accounts to best manage the cost of premiums over a perhaps longer time period. And therefore, a situation could look like this. We're still going to use the same $120,000 of top line retirement spend, but it'll be broken down like this. We're going to have $30,000 come out of the traditional IRA. And the reason why is because we have a $30,000 standard deduction. So let's absolutely take advantage of that standard deduction and make sure that we're using it against ordinary income. So we'll take $30,000 out from the traditional IRA. We're going to take $20,000 out from the Roth IRA. We'll use $50,000 of cash or principal from our investments, and maybe we'll realize $20,000 of that income in capital gains. Therefore, right, because only our traditional IRA withdrawals and the capital gains are included in our modified adjusted gross income, right, that modified AGI number is only $50,000. This again keeps us at 245% of the federal poverty line. Our expected contribution is going to be above 6%, which means that it's a $3,000 per year expected contribution. And that again can go very, very far and even lead us to have $0 bronze plans or even very, very affordable silver plans. And so again, it's just really important to understand that we can pick and choose how much we really want to spend for health insurance, as long as we're willing and able to plan diligently enough on the tax side of things. Now, if this seems like a lot to kind of go through and it seems like something that you might want help managing, you take a look at the link in the description box below and you can learn how I help clients do this on a daily basis. Otherwise, I really hope this video was valuable. And for more videos just like this, please subscribe. Thanks for watching.